Hello YouTube, how are you? I hope this video finds you doing well and healthy. My name is Dr. Facundo Gonzalez and I am an emergency physician in New York. In this video, I will cover everything you need to know about COVID-19 in 2020. Basically, I will go over prevention, symptoms, diagnosis, hospitalization, what determines if you get admitted or not. I will cover treatment, including medications and dosages. And then lastly, I will cover the vaccine, which I'm sure many of you are curious. So stay tuned, this video will be worth your while. Thank you. So we have prevention. With prevention, I think it's pretty simple. We see it all the time. 6 feet apart, wear a mask. Again, interactions. The closer, the longer, the larger the interaction, the higher the risk of exposure and the highest the risk of infection. And of course, the least protected, the higher risk of infection. Okay, next we have symptoms. What are the symptoms? As we all know, there could be any type of flu-like symptoms, respiratory symptoms, GI symptoms, but I must say them in ranking of most common to least common. Most common is cough. About 80% of patients presenting with COVID have cough. Again, these numbers are pretty accurate and they're approximations. I did my research, but I'm just giving a number in between the range. So 80% cough. 70% actually reports loss of taste and smell. 60% shortness of breath. 40% fevers. We also have myalgias 35% of the time, and myalgias just means myo, muscle, algia, pain. So basically generalized body aches. Like when you have the flu, your body feels very tired and in pain. And about 20% do present with GI symptoms, nausea, vomiting, diarrhea. And the thing to know about that is that usually the GI symptoms, they're gonna precede the URI symptoms, upper respiratory infection symptoms, or cough or shortness of breath. Now, moving on to the diagnosis. The diagnosis of coronavirus, as you know, the most common, as you see on TV everywhere, is the nasopharyngeal swab. A swab that goes very far in the back of your nose, bilaterally in both nares. And the thing to know about this test is that it is 60 to 70% sensitive. What that means is that it's very sensitive. That means it can detect the coronavirus when it's there, but that means it's only 60 to 70% sensitive, meaning you can miss 40 to 30%. And that also has to do with how the sample was taken. Was it pushed far back enough? Was it done bilaterally in both nares, etc. But not only that do we use to diagnose COVID, but we also use everything else, the clinical picture. What are your symptoms? What are you feeling? Aside from clinical symptoms, we use imaging. We can do a chest x-ray and we'll check, does your chest x-ray shows this multifocal pneumonia pattern that it is known in COVID, patchy infiltrates throughout. Then, aside from imaging, we also use laboratory testing. We have very specific testing that we order, which some of you may know or may not. You know, we can add LDH, ferritin, procalcitonin, ESR-CRP. ESR-CRP are inflammatory markers. They will be elevated, but ESR will be markedly elevated. Procalcitonin is usually for bacterial infections. That will be mildly elevated. If it is very, very elevated, then you might consider bacterial infection. As we know, ferritin and LDH are going to be high as well. And so basically, as some of the information that we gather, and based on your presentation, your nasopharyngeal swab, and your labs, we make a decision whether yes, you have COVID. And after making the diagnosis of coronavirus, then we determine, should you go home and quarantine? Are you sick enough to be admitted to the hospital? And I'll cover that in a second in the hospitalization section. Okay, I hope you're sticking with me because this is very important and very educational. So now we move on to what determines if you get admitted to the hospital. And again, I just want to do a side comment here that I actually have heard many patients say that they're afraid to kind of come to the hospital because then they get admitted and they get intubated and then people die at the hospital. And I just want to say that that's kind of also a bias because yes, people that are outside who are sick tend to be healthier than people who are in the hospital that do require admission. So in general, yes, they will be more likely to have worsening symptoms and maybe require intubation. Having said that, patients that require admission are those usually that are old, above 65, multiple comorbidities. Comorbidities are other medical problems on top of coronavirus, such as the main three are hypertension, diabetes, obesity. Obesity means a BMI above 30. People that tend to do even worse are usually people that are BMI above 40 or 40. And some labs may also tell you that there will be a worse prognosis, meaning worse symptoms and outcome, such as a D-dimer greater than 2,500. Also, in the hospital, we would check your oxygen saturation level. When you put a pulse oximetry in your finger, you can check if you're 92 and otherwise you're not requiring oxygen at home or anything, that's pretty low. You should be 97, 98, 100. So if you have 92 and then you have a coughing fit, you walk around and your saturation goes to like 91, 90, 89, that's not good. Your body can't sustain oxygen levels like that for many period of days plus symptoms. So then you start requiring oxygen, just a nasal cannula, 2 liters per minute. So those are the patients that we consider for admission, those who are hypoxic, older, multiple comorbidities, and those that we think will worsen over time. Now you made it to the treatment part. So what happens when you get admitted? And this part is actually very helpful for healthcare providers as well. So, as you know, or you may not know, hydroxychloroquine has been discontinued. They have proven that it doesn't help much, and if anything can cause adverse effects, meaning bad outcomes that you don't want. So no hydroxychloroquine. What we have now is steroids. Steroids have been shown to decrease mortality. Steroids meaning dexamethasone, methylprednisone, hydrocortisone. They all show to decrease mortality versus placebo. Placebo is just a sugar pill, fake medicine. And if you like to know, dexamethasone dose will be 15 milligrams per day. And all these steroids, just to point out, are most helpful for people requiring oxygen. Those that have supplemental oxygen requirement, meaning you're hypoxic, you get a nasal cannula, you will benefit from steroids. If you're in your house, not hypoxic with coronavirus, steroids will not help you. So don't call your primary and say, get me steroids. So, number 2, remdesivir. Remdesivir is an antiviral medication that was approved for emergency use in May 1st of 2020. It has shown to improve symptoms, decrease symptom periods, and help with other factors while you're hospitalized. And the thing to know about remdesivir, if you like to know, is the dosage. You start with 200 milligrams the first day, and then you do 100 milligrams daily for 9 days. And this medication is contraindicated if you have liver failure, liver disease, and if you have chronic kidney disease, where you have a glomerular filtration rate, GFR, less than 30, is contraindicated. And the thing to know about remdesivir is that it's expensive and it's only helpful in the initial days of symptoms and when you have oxygen requirement in the earlier periods and stages of the disease. Later on, it has not been shown to have much benefit. Now, of course, after these two medications, I also should mention Lovenox, which again, Lovenox is heparin, low molecular weight heparin, which is given prophylactically because it is known that coronavirus patients are prone to developing clots and even pulmonary embolism, clots in the lung. So, lastly, I won't go into details because it's very complex, but the oxygen treatment for coronavirus, you may start with a nasal cannula, the little tubing that goes in your nose. You go from 2 liters nasal cannula per minute to 6. After you get to 6, you should consider going to high flow nasal cannula. Then you can consider going to continuous positive airway pressure, CPAP. And all those 3 that I mentioned, you could do plus or minus proning. Proning is when you go prone on your stomach, or supine is up, like supination and proning. So proning, you can switch around while you have an oxygenation to provide more aeration to the lung. Then after that, after CPAP, there's other things you might try, but then eventually you might get to when you need to be intubated, unfortunately. But then you get treated and people do come off ventilators and they do get better. So now, last section, stay with me, is gonna be the vaccine. All right, as you can see, for this section of the video, I'm clearly wearing different clothes, a different setting, different lighting, which I actually think I like this lighting better. May use this for my future videos. I'm adding this section because when I was talking to one of my attendings regarding, I'm going to put up a video about COVID-19, everything you need to know, he threw out at me this random casirivimab medication and indebimab medication, saying, it was just approved for emergency use. So I looked it up, and yes, it was approved on November 21st. So I did not want to put up a video without the latest updates, since I still had time to change it and add this section. So basically, casirivimab and indebimab are monoclonal antibodies that made by Regeneron, I think the company that makes them. They were approved on November 21st for emergency use. The thing to know about this medication is that it has to be given together as an infusion over at least 60 minutes, so over an hour. And it's meant for people who have mild to moderate COVID-19, are not hospitalized, or do not require oxygen. So in theory, it's meant for people who are outside in quarantine. Also, it's meant for people, especially for people who have high risk factors or comorbidities that will make them worse in the long run or progress to a worse disease. And these people, there's a whole list, but they're pretty much people who have a BMI above 35, people who are older than 65, people who have diabetes, hypertension, or they're 55 and older with hypertension. So, I don't know, pretty much the entire population, I feel, sadly. But now the problem will be just logistics. How do you go to a provider that can prescribe this for you? How do you go to a provider that can put an IV in the office and infuse it over 60 minutes with monitoring and watching for adverse effects or allergic reactions? And I feel many people would want to get this, and there will be lines, because pretty much a lot of people will qualify for this. So I feel they will have some challenges in regards to logistics. So I just wanted to cover this section and add it to the video, that way it's a complete video. All right, you stuck to the end. Happy to see you still watching. I'm glad you're interested. So now we're gonna talk about the vaccine. The vaccine, the main one I'm gonna talk about is the one that you see most mostly over the news, which is the Pfizer/BioNTech vaccine, which is the B as in boy NT162 vaccine. All the information I'm going to tell you, I got it from different websites, including Pfizer's website. So as far as the status of the vaccine is, they have mainly completed the phase 3 clinical trial with over 43,000 participants, which the phase 3 trial is to show safety and effectiveness. And they have shown safety already, so the FDA has already approved them for emergency use since it has been proven to be safe. They met certain milestones. Also, they have met effectiveness. It says that 30 microgram dose at 28 days has been shown to be 95% effective, which is good. And also, now they're at the point where they might start making contracts and sending out the information to different manufacturing companies. Right now they're working with 4 of them, and the plan is for them to produce, as per the website, 50 million vaccines by the end of 2020, and I think 1.3 or 1.5 billion by 2021. But again, all of this still in the works, and even on their website they have the disclaimer saying that this all is tentative, but that is the plan. So whether this will start coming out in the next few months, or whether they will be able to distribute it around the world, that's yet to be seen. However, that is the latest, as of November 18th, the information that I have. All right, everyone. I'm glad you made it to the end of the video. I hope you found this useful and interesting. If you're not already subscribed, please subscribe to the channel and hit the notification bell. That way you don't miss the video. In the description of the video, I will include some of the resources I used, where I got my information from. As a good scientist, I will, reference my sources. And if you did like the video, let me know. And as you notice, this was all a video about coronavirus in the adult population. If you would like to see or are interested about the children population, just let me know. If I get enough interest, I will make that video. And I hope I was able to summarize this complex topic and all this research and treatments into one concise video. So, thank you for watching.